The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us today. My name is Ann Potempa. I am with the Section of Chronic Disease Prevention and Health Promotion in the Division of Public Health. Welcome to today's webinar that we do routinely for our section to share the work that we are doing. A few housekeeping items at the beginning. If you are listening by phone, please keep it on mute. Please don't put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, which includes a 20-minute presentation from me and then 10 minutes at the end for questions and answers. A recording of today's webinar will be sent to all participants, and the slides and presentation will be put online, and we will share that with you. Next slide, please. There are a number of options for audio that is either going to be coming through your computer or through the phone number that you called in. Please hold all questions until the end of the presentation, unless you have a technical difficulty, and then please add it in the chat or comments for us to see. When you're ready to ask questions, you can raise your hand by clicking on the hand button, and you can also type in your question in the field that's available to you. We can unmute you or else read your question out loud, and we'll answer those again at the end. So I'm going to turn off my camera so we can focus on the slides, and I'm going to begin our presentation. Next slide, please. So again, my name is Ann Potempa, and I'm a public health communications specialist for the Section of Chronic Disease Prevention and Health Promotion. For the past few years, I've been sharing webinars like this about the campaign I've helped run since 2012. It's called Play Every Day, and it's a social marketing campaign to help Alaska children grow up at a healthy weight by getting daily activity and choosing healthy drinks. This year, our webinar is taking a different direction because we're all taking a different direction right now. When the COVID-19 pandemic started in Alaska last spring, our public health messaging focused on what to do to prevent getting the COVID-19 virus. As we learned more about this virus, we learned that having ongoing health problems could make it harder to fight the virus should you get it. In Alaska, about 1 out of 3 children is overweight or obese. About 2 out of 3 Alaska adults are overweight or obese. And obesity increases your chances of having weight-related diseases like type 2 diabetes and heart disease. In Alaska, about 1 out of 12 adults have diabetes, and almost 1 out of 3 adults have high blood pressure. Now, we've learned that having just one of these health problems, obesity, diabetes, or high blood pressure, can make it 3 times more likely that you need to go to the hospital if you're sick with COVID-19. So it's important to try to prevent getting the virus, but it's also essential to stay in the best health possible all year round to help your body fight the virus if you do get it. And that's where Play Every Day comes in. That's where we pivoted and started using our campaign to focus on ways to help Alaskans stay active during this tough time for both their physical and their mental health, and to keep choosing healthy foods and drinks to keep their bodies in the best possible health. Next slide. During this webinar, I'm going to talk about how our new materials address health concerns related to the pandemic. I'll talk about how we try to reach Alaska families wherever they are. While our new materials are definitely addressing the pandemic, we're still continuing with a campaign we started several years ago to reduce sugary drink consumption among families with young children. I'll talk about how we listened to parents with preschool-age children as we prepared these messages, and then how we moved to develop and share them through partnerships with organizations like the Alaska Native Tribal Health Consortium. I will then talk about how we share these materials across the state and how we will be evaluating them. Next slide, please. From the beginning, our Play Every Day campaign has focused on the goal of encouraging children to be physically active every day for the best health. For school-age children, our message says, get out and play 60 minutes every day. and that is the national recommendation for daily activity. The pandemic, however, made physical activity more challenging for families. Child care centers and preschools started limiting class sizes, and school buildings closed. Daily opportunities for activity stopped for thousands of kids with in-person PE class and a pause to recess. Some extracurricular activities stopped, and the guidance to keep 6 feet of physical distance at minimum from others made some activities really hard, like contact sports or even a backyard game of tag. Next slide, please. The pandemic has been going on for months, and we're all trying our best right now. Parents, like myself, are balancing more than we've ever had to do before. We're working often from home. We're caring for little children. We're helping older children learn, sometimes online, and we're doing this all in the same day. So our health department surveyed Alaska parents last spring, right after the pandemic started, to hear about what was going well or what struggles they were having. And we heard that 6 out of 10 parents said their child was getting less physical activity each day than before the pandemic. And at the same time, almost 8 out of 10 parents said their child was getting more non-academic screen time each day than before the pandemic. And that includes time watching shows, playing games, and using social media. Next slide, please. Between March and August 2020, we created and shared educational materials related to these concerns through multiple routes. We created a new 30-second public service announcement about safe physical activity right now. We shared similar online messages. We posted daily Facebook messages to Play Everyday's 13,500 followers. We've written and published 15 blogs on the Play Everyday website, which is playeveryday.alaska.gov. And we regularly send out emails about these blogs and the materials to listservs that reach thousands of Alaska families. Next slide, please. I'm going to share the 30-second PSA we filmed about playing safely. I'm proud of our staff and partners for finding ways to continue doing this important work during the pandemic. It's much harder to film a message when it's also critically important to stay at least 6 feet away from others to prevent spreading illness. We filmed this message at a time when the recommendation was to keep your social bubble really small as your own family or household. So how do you film a video if you're only supposed to be near your own family? Well, the answer is you film your own family. We're fortunate to work with a film crew led by a videographer who has a family of his own. We talked to him about our idea for this video and what we wanted to show. We wanted to show that you could still get out and play right now, and that was so important to do for your physical and mental health. And physical activity has been shown to reduce stress, feelings of anxiety, and depression. And there are many ways to add activity to your day. So the videographer took that direction and filmed his own children near their home, which was another recommendation at the time when this was filmed. They climbed the butte in the Matsu Valley. They wore face coverings while they hiked, just in case they might pass others while breathing hard. And they jumped on pillows in their living rooms. Then the videographer combined that with previously filmed scenes we had on file. It showed how movement can bring joy right now. We're going to play this PSA right now. I will let you know that we all have different connective abilities right now, so it may buffer on your end. My apologies for that. If it does, I have included the YouTube link at the bottom of this slide so that when it is shared publicly, you can find this and watch it again. Another easy way to find this is just go to YouTube, and I will give you this address again later, and go to Play Everyday AK, and all of our videos are there and you can watch them again. So we will play this video now.
It's a challenging time right now, but you can still get out and play. Staying active improves your mood and reduces stress. You can do indoor and outdoor activities as a family. Remember to stay at least 6 feet away from others, and wear a face covering when you're breathing hard and might pass others. So get out and play every day.
Great, thank you. If you could advance to the next slide. When I started talking, I mentioned how it's a goal of our campaign to reach families wherever they are. The video I just showed can reach families in a lot of ways. We share it through television, we post it online on our website, we routinely share these videos with schools so they can be shared with students, and we share them with health clinics across the state where people often see them while sitting in waiting rooms. We also create online messages. We share these on websites that Alaskans might visit. Here is an online message we made for Safe Play. I'm going to click through it to show how you'd view it if it were to show up on a website you were visiting. So here's the first slide that would rotate. It says, stay active with your family. It improves everyone's mood and reduces stress. While active outside near others, wear a face covering. And give others some space. Get out and play every day. Next slide, please. Play Every Day is an avid user of social media because it's just one more way for us to reach Alaska families where they are. When we talk to parents in focus groups, which I'll talk about again soon, we routinely hear from them that one of the media that they use the most, often on a daily basis, is Facebook. And so we intentionally use this as a way to communicate with Alaska families of young children. Over time, more than 13,500 people have signed up to follow Play Every Day on Facebook. And that really provides a large audience for us to share our messages. Knowing that we've committed to reaching parents that way, we post daily, sometimes more than once a day. We'll share new materials there. We'll link to our partners like the Healthy Futures Challenge that provides a free physical activity challenge for thousands of elementary kids attending 125 schools this fall. Here are two Facebook posts that we designed to promote safe physical activity during the pandemic. They both include Alaska children featured in the short video you just watched. They stress important topics like wearing a face covering when you're active near others and being active with your family, but keeping distance from people outside your household. Next slide, please. These recent Facebook posts talk about the importance of keeping your hands clean, being active to improve your mood and reduce stress, and again to wear that face covering when active outside and passing by others. Next slide, please. We have a unique opportunity with Play Every Day to be able to write a blog and regularly publish and share that with families. We created the blog a number of years ago on the website, playeveryday.alaska.gov. I write many of them, but my colleagues and partners contribute too. The blog's been a really great way for us to stay current during the pandemic and share the most up-to-date guidelines for COVID-19. As I mentioned earlier, we've published 15 blogs since the start of the pandemic that relate to COVID-19 and families' health and safety. Just recently, they've been republished and shared through what's called the new DHSS Insights blog that you can find on the state's COVID-19 website. This Play Every Day blog on the slide was published in May, right around the time the state was opening back up after the hunker down period. Many people were lonely or needing more help with caregiving. We read through related research and talked with our lead doctors before sharing this possible next step through this blog. And that was slightly enlarging your social bubble with one other trusted household. Next slide, please. In June, we published this blog about another question we kept hearing. Should you attend parties or community events? And if you do, are there decisions you can make take to make that encounter safer? We talked about how outside events generally offer more air movement and physical distance, so that can reduce the chances of spreading COVID-19. We talked about wearing face coverings when you could get near others, and additional ways to connect with people that aren't face-to-face. Next slide, please. At the end of August, the new school year started again, and kids started going back to school in many different ways, online, at home, or a combination of that. We talked to school district staff and PE teachers to share the creative ways they were getting kids moving, no matter how they were learning. It was really inspiring to see how hard these teachers were working to keep kids engaged right now. We shared the story of a Matsu PE teacher who went out and bought paint so she could mark off a large space outside the school that looked a lot like the indoor gym. Whenever possible, her PE class is going to be outside to reduce the spread of illness. Each child has a colored marking on the field to help them be active, but still have distance from others. We also shared the story of an Anchorage PE teacher who's offering weekly PE classes for all grades through Zoom because the Anchorage School District is all online right now. That teacher also offers a bonus wake-up PE session in the morning 4 times a week. And dozens of kids start off their day moving and learning about nutrition. Next slide, please. We're still very much in an uncertain year, and given that, we're going to continue advancing toward our long-term goal of helping kids grow up at a healthy weight by running year-round materials to support safe daily physical activity during the pandemic, and messages to promote reducing sugary drink consumption. We're going to keep focusing on our target audience, which is Alaska parents of children in preschool and elementary school. And we're going to continue to use focus groups and conversations with families to inform our messages and then follow-up surveys to evaluate our work. Next slide, please. I started by saying that Play Every Day is a social marketing campaign, and what that means is our work goes beyond raising awareness that we have a health concern in Alaska. That being 1 out of 3 Alaska children are growing up at an unhealthy weight. We follow a 10-step repeating process that takes us beyond raising awareness. Ultimately, we want to improve Alaska families' understanding of the importance of daily activity and choosing healthy drinks. And then we want to go even further and encourage healthy behavior changes, like helping families get that 60 active minutes every day and to buy water and milk instead of sugary drinks and consistently serve those to their children. One of the key steps in this process is listening to our audience and finding out what they know, what they don't know, and what might motivate them to learn more or change what they do, eat, or drink. During the beginning years of Play Every Day, our main target audience was Alaska parents of kids ages 5 to 12, those in elementary school. During the past couple of years, we've expanded our audience so our work is better aligned with a grant that falls under our program. It's from the CDC and it's called the State Physical Activity and Nutrition Grant. One grant objective is to improve physical activity and nutrition in childcare and preschools. And we wanted Play Every Day to reach that same audience, so our new messages in recent years target Alaska parents with 3 to 5-year-old children. Addressing these messages to parents of young kids is also important because that ties into one of the Healthy Alaskans 2030's leading health strategies. And that strategy is to reduce the percentage of 3-year-olds who drink any sugary drinks on a given day. Our most recent look at this shows that in Alaska, more than 1 out of 4 3-year-olds drink at least 1 sugary beverage a day. Finally, an important and necessary ingredient for campaigns like Play Every Day is that they evaluate their ability to reach their audience and lead to positive changes. Are the messages reaching Alaska parents of young kids? Are they improving knowledge? And are they supporting positive changes? Next slide, please. We continue to learn from our target audience by listening to them. We do that through holding focus groups, and those typically have 6 to 10 parents of young children. We ask these parents about their understanding of sugary drinks. We talk to them about how many sugary drinks they have as parents and how many they serve to their little kids. We test messages with these families. We want to know if the messages are meaningful and motivating to families before we even film or finalize them. We have these discussions with parents in urban and rural communities, and we include parents who say they regularly serve sugary drinks to their kids. Next slide, please. Overall, parents tend to know the health harms of sugary drinks, obesity, cavities, type 2 diabetes, even heart disease. But what they don't always know is that a small sugary drink, like this sweetened powdered mix, can be packed with a large amount of sugar. Over time, that sugar can add up to health problems. 4 leading health organizations have published new healthy drinks, healthy kids guidelines that say sugary drinks are not recommended for children ages 5 and younger. The US dietary guidelines for Americans also recommend that older kids and adults limit daily added sugar to less than 10% of the calories they eat and drink every day. We know some kids and adults have more than that by the end of each day. Next slide, please. We've learned so much from Alaska parents. Parents know common sugary drinks like soda, but some don't know that other sugary drinks are just as concerning when it comes to health outcomes. Vitamin drinks, sports drinks, sweetened fruit and powdered drinks, and chocolate milk have added sugar. Ounce for ounce, a sweetened fruit drink can have the same amount of sugar as a soda. We also hear from parents that they start serving sugary drinks early, sometimes when their child is 1 or 2 or even younger. The first sweetened drinks for little kids tend to be powdered or liquid fruit drinks. Chocolate milk is another one. Next slide, please. Again, we were able to continue doing our work and do meaningful work during the pandemic. All of our lives changed dramatically last March after that first COVID-19 infection was reported in Alaska. And many of us, including me, started working from home. And we started following guidance from our own health department to prevent the spread of virus. And that meant hunkering down at home for a while. And then as we reopened, it meant keeping enough physical distance from you and others. But again, part of what we do as a campaign is to show real Alaska families being active in choosing healthy drinks. We were all ready to film 2 new videos with scripts that tested well with Alaska families. This work became more difficult with the pandemic. Could we still film and photograph families and as well as follow our state's guidance to prevent spreading COVID-19? And the answer was yes, but we had to make some significant changes. We altered our scripts. We changed the storylines in both of the messages to be filmed entirely outside. Again, outside can be safer in terms of preventing the spread of COVID-19. We also prioritized having a minimal crew, the smallest number of people there to do a great job. We made sure that we kept physical distance from the families involved while we were filming and taking photographs. Everybody on set who was filming and photographing kept face coverings on during the production, and we had hand sanitizer and disinfectants there as needed. Next slide, please. We were able to film these messages both over the summer using distance face coverings and outside scenes. The first message that I'm going to show you right now uses kids' love of magic tricks to show how children can quickly make large amounts of sugar disappear just by drinking it. We'll show you that message now.
And now, for my next trick, I can make all the sugar disappear.
Show me. Kids can make large amounts of sugar disappear just by gulping down the drinks that we buy them. And sometimes they even look healthy, but they're loaded with added sugar. There's no illusion about this healthy drink. It's just water, and it's what kids need.
Thank you. Next slide, please. Our other new message this year looks at the relationship between children and their parents. Kids are always watching and copying the adults in their lives. So if you're a parent and you reach for a soda, what is your child going to want? We created this new video to put a healthy twist on that copycat behavior. Let's say you choose a bottle of water instead of a bottle of a soda or a vitamin drink. Then your child may be more likely to want that healthy drink too. We're fortunate to work with 2 partners on this message. The first is the Chugach National Forest, which gave us permission to film near Portage Creek. The second is our longstanding partner, the Alaska Native Tribal Health Consortium. They recommended this Anchorage family to appear in the video, and ANTHC will work with us this year to share the message with as many families as possible. We'll show you that message now.
Daddy, can I go with you? Daddy, can I help you? Daddy, can I please have some?
That soda is filled with added sugar that can lead to a lifetime of health problems. Your kids just want to be like you. Choose healthy drinks for you and for them.
Next slide, please. A year ago, we printed 2 new posters that encourage parents to serve children water and milk. We've printed these posters and made them available for free online. We also share these with partners, including childcare centers, preschools, pediatricians, other medical offices, dental clinics, tribal partners, and more. Next slide, please. We've also made new websites for Alaska families with young children. This webpage focuses on serving healthy drinks to preschool-age children, and the web address, again, is at the bottom of this slide. Next slide, please. This similarly designed webpage focuses on the importance of giving little kids opportunities to play throughout the day. And again, the website is at the bottom. Next slide, please. There are several ways to engage with Play Every Day online. The main website is playeveryday.alaska.gov. Again, we use Facebook, Instagram, and YouTube. And all of those sites can be reached at Play Every Day AK. Next slide, please. Each year we make sure our new materials as well as our past materials are available to anyone for free. This website includes downloadable posters, handouts, and videos focused on physical activity. Next slide, please. And this similar website, again, website at the bottom, includes posters, handouts, videos, and more focused on reducing sugary drink consumption and choosing water or milk instead. Next slide, please. Thank you for joining our webinar today, and thank you to everyone who works with us to share Play Every Day's messages. Thank you for supporting families and getting 60 minutes of physical activity every day and cutting back on sugary drinks. Thank you for sharing our messages. Please reach out if you'd like to hang any posters, hand out rack cards, or share handouts. All of our videos are online. Again, we share our materials through Facebook and other social media. And as always, we're more than happy to mail out any materials to you. Please email me. My email is on this slide. Reach out at any time by email or phone, and we're happy to share what we have. Thank you again, and we have a few minutes for questions. Please feel free to type them in the chat box or question box, and we'll look for those there, or raise your hand. While we're waiting to see if any questions are in, I will remind you that we will be posting this entire recording as well as the slides that I shared today on our section of chronic disease prevention and health promotion website for webinars. And when we do that, we will send everyone who has registered an email to let them know where they can find it. Again, the campaign website is playeveryday.alaska.gov, and all of our social media accounts, Facebook, Instagram, and YouTube, can be found at Play Everyday AK. We will continue to have webinars throughout this year that focus on the work of a number of our programs, including our tobacco prevention and control program and our youth risk behavior survey. So when those are ready to share, we will send out similar announcements to let you know and that you can sign up. So please look for those in your emails, and we appreciate you listening in on our webinars. Alyssa, are you seeing any questions on your end? I am not seeing any come in.
Nope, I do not see any.
Okay. Well, thank you everybody for your time. Again, my email and phone number are on the end of this presentation. Please feel free to reach out for any materials or to share these messages. And thank you again, and we will stay in touch about future webinars.